Knee isometric. So an isometric contraction is just using the muscle without having the joint actually go through range of motion. We are going to work on the knee, so knee isometrics. First one is going to be an isometric of knee extension, so I get the quads. All I'm going to do is find something, could be a doorway or really heavy sandbag, doesn't matter what it is, and I'm going to press into that weight, hold that for 10 or so seconds, and relax. If I'm dealing with a new knee injury, sometimes this can be painful, at least for the first couple of seconds, but can actually help relieve pain after a few repetitions. So knee extension, I'm just pushing the ball of my foot into the weight that way. Knee flexion, I'm going to put my heel towards the weight. I'm going to pull, using my hamstrings, pulling my heel towards my bum. 10 seconds, 10 seconds, 10 seconds. I can do this with varying degrees of knee extension as well. I can have my knee totally straight and still use that isometric, okay? Or I can have it different degrees of flexion. The next ones are a little bit more tricky, but I'd still like to do them. They're rotation of the knee. So the knee doesn't have a ton of rotation. Most people end up using the hip when they're doing this motion, but I still like to do knee rotations, especially after an acute injury, because those tend to be some of the more painful ranges of motion. So I get really close to the weight, I stick my toes up to the air, and then I'm trying to push my toes into the weight that way. I'm using basically the outside of my calf to do that, and relax. Press and relax. If I was doing the other side, I'll demonstrate with the other leg. It's the exact same thing. Trying to keep my knee fixed, heels on the ground, pushing my toes into the weight. This motion is very hard to do with your knee completely straight, but you can do it with varying degrees of knee bend. Generally, you want to hit all 4 range of motions as long as you can tolerate them. This is good for things like swelling. This is good for things like stiffness. It's also good for just flat out pain control, because we know that isometric contractions can actually decrease our pain for a period of time. So 10 seconds-ish, usually 3 to 5 reps in each direction. Give that a shot for a few sets and see what effect it has on your knee pain.